A lot of people think that varicose veins come from crossing your legs too much or just from aging. Age does play a role, but it is only part of the story. Hi, my name is Dr. Jarrod. I'm a vascular surgeon here in Cary, North Carolina, and today I want to talk about what actually causes varicose veins, and hopefully this video will be helpful, it'll be simple and clear, and I'll help you understand what's going on in your body. So a little bit of background. Your veins carry blood out of your legs back up to your heart, and in your legs, your veins have to fight against gravity. So the way they do this is with the use of one-way valves. When those valves weaken, blood can flow backward and then just sit there in your veins and increases the pressure in your veins. That leads to symptoms of varicose vein disease. That extra pressure causes the vein to swell, to twist, to turn. Then you start seeing it in your skin as a varicose vein. But the question is, what causes those valves to weaken in the first place? Varicose veins don't just appear out of nowhere. There's usually a reason beneath the skin surface. When we talk about what's causing varicose veins, we divide it into primary causes of varicose veins or secondary causes. When we say primary venous causes, that means there isn't a preceding condition or event that leads to varicose veins. And when that happens, that usually means that the vein wall or the valves and the veins weaken, and that's what's leading to varicose vein disease. But in some cases, there are secondary causes of venous disease, and what that means is that there is a condition or event that happens and leads to varicose vein disease. Most commonly, that preceding condition or event is deep vein thrombosis or clots in the important veins of your legs. Normally this is years before, and so this can affect the way blood flows through your deep veins, leading to varicose vein disease. In this video, I'm just going to focus on primary causes of venous disease. So let's get into that. Number one, family history. If your parents or you have siblings that have already developed varicose vein disease, there's a chance that you will develop it as well. What's happening is that people inherit genetic causes which lead to weakening in your vein walls or in your valves. And that leads over time to improper flow in the veins of your legs, and that leads to varicose vein disease. Number two, hormones of pregnancy. Many patients come in saying that, after their first pregnancy, that's when they saw varicose veins start popping up in their legs. What's happening there is that the hormonal changes due to pregnancy leads to weakening and softening of the vein walls, and it leads to improper flow, which leads to varicose veins. Number three, long hours standing or sitting, not just standing, but if you have a job where you're standing for a long time, we see a lot of times nurses, people in the medical profession, or if you're, your job, you're sitting a lot, maybe you're in a cubicle all day, those are occupations which tend to lead to varicose vein disease. What happens is the circulation in your veins slow down, and over time that can lead to improper flow, leading to disease. Next, we have weight and movement. Many people ask, does gaining weight or does my weight have anything to do with varicose veins? Unfortunately, it does. And just the simple fact of carrying extra weight and having a sedentary lifestyle, you can think of it as increased pressure that the veins are experiencing because of the increased weight, and that leads to improper flow. Remember, calf muscles also play a role in keeping vein circulation normal. So if you live a sedentary lifestyle or increased weight, you're not moving as much, that can lead to improper flow, increased venous pressure in your legs, leading to disease. Age is commonly misunderstood. Most people think you have to be much older in order to have varicose veins, which is true. Vein valves weaken over time. And if you were to look at most people over the age of 60, more commonly have varicose veins. But the reason why I included age at this point, after some of the more common risk factors, is a lot of times people in their 20s and 30s, they figure, well, it's impossible to have varicose vein disease because I'm not 60. Well, if you have some of the other risk factors we talked about, obviously you can have varicose vein disease. But when we talk about age as a risk factor for primary venous disease, We're talking about people at least in their 60s. So briefly, I want to talk about a secondary cause of venous disease. I know that in this video, I'm just focusing on a primary cause, but this question comes up a lot. And patients who have had a prior deep vein thrombosis, or DVT, which is a clot in the deep veins of your legs. And most of the time, this is like years before. That can affect your circulation in your veins. That can lead to increased pressure, which over time tends to lead to varicose vein disease. So those are the risk factors. If you've noticed that your legs feel heavy, swollen, achy, especially at the end of the day, it may be worth having your veins evaluated. If you've noticed varicose veins that seem to get larger or more uncomfortable, there's also something to pay attention to. An evaluation doesn't mean that you're committed to getting treatment. It's all about clarity to figure out what's going on in your legs. Getting your legs checked with a vein ultrasound isn't about commitment, it's about clarity. So what do you do if you have some of these risk factors that I discussed? Sometimes just small lifestyle changes can help tremendously. What I'm talking about is just walking. Start off maybe 10-15 minutes a day, build up to 30 minutes a day, or as much as you can. 3 times a week is fine. Also, wearing compression stockings, that can help tremendously. These 2 small lifestyle changes support your vein circulation and can help reduce your risk if you have some of the risk factors for varicose vein disease. As I said before, if further steps are needed, if you want to get more clarification after doing these lifestyle changes, there are modern, low-stress ways to get your legs checked, which is with an ultrasound. The key is understanding the cause, and I hope that becomes clear with this video, because once you understand it, you can decide what, if anything, needs to be done next. Knowing the cause of your symptoms can give you options, even if you choose to wait. Remember, this video is for educational purposes. It doesn't replace a medical evaluation, and of course, it's not offering treatment advice. Everyone's vein system is unique, and if something feels off, getting a professional opinion can help. So remember what you can do now if you have some of these risk factors for developing varicose vein disease. Number 1, start walking. Like I said before, 3 times a week works. Build a walking regimen. 3 times a week is fine. It's a fine starting point. Number 2, wear compression stockings. You can order compression stockings online. For the best fit, some stores will measure your legs for you. Work your way up to 8 hours a day. You can start off with low pressure stockings. That will really help your vein circulation and hopefully help prevent varicose vein disease. Remember, understanding your veins isn't about fear, it's about confidence, it's about clarity. All right, thank you. I hope this video helps. Leave comments below, and y'all take care.